Okay, so let's start with the topic of median nerve. So firstly, I would like to discuss the formation of median nerve, the course and the relation, the branches of median nerve, and the clinical anatomy related to the topic. Now, if I talk about the median nerve, it's the thickest nerve of the brachial plexus. So why it is the thickest nerve? Because it is formed by both medial root and that of lateral root. So medial root is basically derived from medial cord of brachial plexus, that is C8 and T1, and lateral root is formed by the continuation of lateral cord of brachial plexus. Okay, so the formation is by the two roots of brachial plexus. So the root value of the medial root will be C8 and T1, and the root value of lateral root will be C5, C6 and C7. That means together it is formed by the ventral rami of, if I talk about its root value, it is formed by the ventral rami of C5, C6, C7, C8 and T1. Now basically if I talk about median nerve, it is giving innervation to the muscles of forearm. Few of the muscles of the hands also, that is the intrinsic muscles of thenar region and also the first and second lumbrical muscle. So basically, but most of the muscles of the forearm flexor group is getting innervation from median nerve. So it is also called as the labor nerve. So just the opposite of it is the ulnar nerve. Why? Because ulnar nerve is giving innervation to intrinsic muscles of the hand. So it is called as the musician nerve, because the role of that muscle is basically performing the finer movements. For example, lifting any heavy object and all, these all requires the forearm muscle, which is getting innervation from median nerve. So it is called as labor nerve. Now I would like to show you the image of brachial plexus, where once again you can know the formation of median nerve. So let's see this image. So let me just enlarge this diagram. So when I am enlarging it, I would like to show you that this is the median nerve and this is the median nerve, and here you can appreciate this part is arising from lateral cord of brachial plexus. So this is the lateral root of median nerve, which is arising from the lateral cord of brachial plexus, and this is the medial one, which is arising from the medial cord of brachial plexus. So this is how the median nerve is formed. So basically in this diagram you can appreciate that median nerve is formed by taking the root value as the lateral root and this is the medial root. So both lateral, L for lateral and M for medial root is together joining to form the median nerve, which is the thickest nerve of the brachial plexus. Now let's talk about the course and relation. So as we already know that brachial plexus cords are related according to their name around the second part of axillary artery. So we know that here when I am talking about the median nerve, it is basically in the axillary region lying lateral to the third part of axillary artery. So it is formed in the axilla and it is a branch of having origin from both medial and lateral cord of brachial plexus, and it is located lateral to the third part of axillary artery. Now subsequent branches, if I talk about the subsequent branches, so subsequently you can see it descends in the arm, and we know that the continuation of axillary artery is brachial artery. So axillary artery changes its name and becomes brachial artery. So in the arm it is descending lateral to brachial artery, and just in the middle of the arm, when I talk about its relation, exactly location in the middle of the arm, it is crossing in front of the brachial artery. So firstly it is lying lateral to third part of axillary artery, then it lies lateral to the brachial artery, and in the middle it crosses in front of the brachial artery. That means it wants to change its direction or its location from lateral to medial side. So you can see this diagram. Let me enlarge it. Here you can see this is the median nerve, and clearly in this diagram, if I use another color so that you can understand, this is the median nerve and in the middle crosses in front, and now you can see the location. So here this becomes the median nerve. So what you can say, firstly it was lateral, now it is lying medial to the brachial artery. So it is changing its direction, it is crossing in front of brachial artery so that it changes its direction or location from lateral to that of medial to brachial artery. Now, so that means if we will see the relation, of the median nerve in the cubital fossa, you can see it is located exactly onto the medial side of brachial artery in the cubital fossa. So at the level of cubital fossa, you can see the relation and you can clearly see this is the brachial artery and just medial to it lies the median nerve. So here you can say this is the medial side and this is the lateral side. This is the lateral side. So in the cubital fossa, median nerve is located just medial to brachial artery. Exact location is median nerve is located just medial to brachial artery. So only we memorize the relation of structures in the cubital fossa by the mnemonic MBBR. So this relation of the structure is from medial to lateral side is MBBR. In some of the books it is also written MBBS. So here the medialmost structure is the medial nerve, then B for brachial artery, another B for biceps tendon. This is the biceps tendon which you are seeing, and the fourth structure is the radial nerve. Now, subsequent course in the elbow, when we are talking about the subsequent course of the median nerve in the elbow, it will pass behind the bicipital aponeurosis in front of brachialis muscle. So, when I am talking about brachialis muscle, it is the muscle which is forming the floor of cubital fossa. And median nerve is lying behind, means posterior to bicipital aponeurosis. So just see this diagram here. This structure, so I would like to show the medial extension of the biceps tendon. So medially the biceps tendon is forming an flattened structure that is called as the bicipital aponeurosis. So this is the bicipital aponeurosis. Okay, this is the bicipital aponeurosis, and you can appreciate in this diagram just posterior to bicipital aponeurosis two important neurovascular structure is traversing, that is the brachial artery and the median nerve. So brachial artery and median nerve is traversing and passing below the bicipital aponeurosis. Now, I would also like to show you this cadaveric image where you can appreciate the location of median nerve in the cubital region. So see here, let me just enlarge this image. So when I am enlarging this image, okay. So when I am enlarging this image, you can see here the floor muscle. So you can see here the floor muscle. Here two floor muscles has been shown, brachialis and supinator. So both brachialis and supinator muscle. Here this is the brachialis muscle which is forming the upper part of the floor of the cubital fossa, and this is the supinator muscle. Okay, this is the supinator muscle which is forming the lower part of the floor of cubital region, and we can clearly appreciate here the median nerve. This is the median nerve which is shown in this diagram. So this is the median nerve which is located in the cubital fossa, and in this diagram you can see here also you can see the biceps tendon. This is the biceps tendon. Okay, so this is the biceps tendon. So this structure is the median nerve and this is the biceps tendon. So exactly median nerve is located medial to biceps tendon. Okay, medial to biceps tendon. Lateral structure, so here you can also appreciate this lateral structure which you are seeing is the radial nerve, and this is the deep branch of radial nerve. So here you can see this structure which you are seeing is the radial nerve which is giving innervation to the supinator muscle. This is what? This is the radial nerve. Other than that, you can also appreciate the cubital fossa medial and lateral boundary. So here you can see the diagram where you can see this is BR, this is the brachialis muscle which is shown to you, which is the lateral boundary, which is, and this is pronator. This is pronator, PT for pronator teres muscle. So pronator teres muscle is also shown in this diagram. So yes, we know that this is medial epicondyle, which is the common flexor origin, and you can see the PT, pronator teres muscle, and brachioradialis. Pronator teres muscle is forming medial boundary and brachioradialis is forming the lateral boundary. So you can see here the median nerve is running over the floor muscle, brachialis and supinator. Supinator muscle is getting innervation from radial nerve, deep branch, and medial location is, so to the biceps tendon, we can see medial to it lies the median nerve. So we have done with the course and relation at the level of the elbow. Now subsequently, let's see the course and relation in terms of the forearm. So in the forearm, the median nerve will traverse entering between the two heads of pronator teres muscle, which is forming the medial boundary of cubital fossa. Thereafter, it traverses deep to the tendinous arch or the bridge which is formed by the two heads of the flexor digitorum superficialis muscle. So, firstly, median nerve is traversing between the two heads of pronator teres muscle. At times, it can get compressed between the two heads of pronator teres muscle, called as pronator teres syndrome. Thereafter, it will pass between the two heads of origin of flexor digitorum superficialis muscle. So, I would like to show you this diagram. So, if I enlarge this, you can see here this is the median nerve which is traversing here, and when it is at the level of the cubital region, their lower aspect, it is passing between the two heads of pronator teres muscle. Now, here one more diagram is there where you can appreciate that median nerve is traversing in relation to between the two heads of flexor digitorum superficialis. So, these two diagrams are showing you the relations of median nerve. Now, let's talk about the further subsequent course of the median nerve. After traversing between the two heads of pronator teres and between the two heads of the FDS, it will descend between the deep muscle of the forearm and the intermediate group of the muscle. So, we know that when we go for dissection, we have got FDP, that is flexor digitorum profundus, is located deeper aspect in the forearm, and if we talk about FDS, which is written in few weeks as superficial aspect, to be more clear, it is lying at the intermediate level. So, in between these two muscles, the median nerve is traversing. Okay, so exactly the location of median nerve is between the FDS and that of FDP. FDP is the deeper muscle of forearm flexor group and FDS is the intermediate level. It is located at the intermediate level in terms of its location. So, and just approximately 5 cm above the level of transverse carpal ligament, that is flexor retinaculum, it will emerge through the lateral edge of FDS, flexor digitorum superficialis. So, see here, we can see the flexor digitorum superficialis muscle and we can see the median nerve traversing here. Thereafter, what